And then, of course, there are more serious things that come up, or more concerning things that sometimes come up, and feel more risky or more unsafe.
Yeah, I think that's a big question that comes up for parents, and things like drug and alcohol use, sexual relationships, and again, depending on sort of the age, some of that exploration can be considered within the norm. And I think, though, when a teenager is experiencing a lot of anxiety, for some young people they can turn to drugs and alcohol just as a way of trying to cope and trying to get through. And so even with, drug and alcohol use, it's thinking about, actually there is a difference between going to a party and having some drinks with friends, and when does that become a point where the young person can't go to a party without drinking because they're feeling too anxious, or actually are they starting to drink, it's that frequency again, are they drinking more often? They might be even starting to drink on their own. They are the really big warning signs around the drugs and alcohol, and how anxiety may play a factor in that. Another big concern of parents and caregivers is mood and depression. And I think anxiety and mood, they come hand in hand, because it's a lot to navigate in adolescence anyway. And then when you're dealing with kind of constant anxious thoughts about yourself and about the world, it's exhausting. It is a lot. And so sometimes, while they're juggling with all of that anxiety, then their mood, you can start noticing their mood dropping off.
And I'm thinking, Jess, often anxiety comes up in anticipation of something that's hard. And then, but because when we get to adolescence, we can start doing cognitively, we do a lot more reflective stuff as well. Then we start thinking about, how did we do, and evaluating and judging, and then that becomes really negative and affects our mood. So they do spin off one another.
Yeah. When like you sort of talked about some more of the riskier ways that young people manage anxiety, and I think when the anxiety can become really intense, and young people often have tried multiple ways to try and make things easier, they can get to a point where actually they might start using things like self-harm as a way to cope. And I think it can be really hard to understand as a parent, and it's scary. And for young people, that just becomes a way of coping. So it can be a way of just managing those really intense feelings that come with anxiety, or the disappointment, and there's that self-critical part. So it's a way of coping. It can feel like they're getting through those emotions. They might feel more grounded. They might feel more another way to kind of just a different feeling as well. So it is a really scary thing. But the parent finds out or hears about it.
It's a go-to to what can I do to feel a bit better in this moment. And sometimes it can be bigger than that this is, how I feel about myself is so negative. And it really is trying to understand for each young person what that means for them.
Absolutely. It can be quite different for different people.